what I'll do is I'll start to drill through the skull. And it takes a minute to get through. And my name's Brian Hoeflinger. I'm a board certified neurosurgeon, and I want to show you one of the most common procedures that we're taught early on in our residency to perform. And typically it's emergency procedure for life-saving measures. It's usually performed in the emergency department or in the intensive care unit. It should only be done by a trained professional, and obviously it's not something that you should try at home. And what we do it for, it could be somebody who's had a bad head injury and they come in to the hospital and we need to monitor the pressure in their brain and maybe relieve fluid off of the brain. Or it could be someone who's had bleeding into the brain, into the fluid cavities, and the fluid is building up. And so we need to relieve that pressure of the fluid building up to save their life. I perform this procedure with the patient lying flat on their back. And typically, if they're had a bad head injury, they may be comatose, but most often we'll have the patient intubated and we'll sedate them lightly if they're just sleepy. And then what we do is I will clean the area up over the scalp where I'm going to make the incision, and I put some numbing medication into the skin. And then I'll make a little incision through the skin. And then through that incision, what I do is I use this drill. It's a hand drill, and I've used this most of my career. They do have power drills nowadays, but I prefer this type of drill. And someone will be holding the head for me. But what I'll do is I'll start to drill through the skull. And it takes a minute to get through. And as that bone dust comes out, it goes backwards out of the hole, and then we just irrigate it away. And obviously this is all done in a very sterile fashion. And then as I get towards the inner part of the skull, you can feel a difference in the drill. It'll start to turn hard and it'll kind of pull in. And then what you do is you pull back on the drill and it will pull the rest of the bone out and then create that hole. Then what I do next is I have this little blunt instrument and I pass that through the hole, and I puncture a little hole through the covering of the brain to make it a big enough opening so I can pass the tubing through. Then what we do next is I'll have what's called the ventricular tubing, and it'll be over this inner stylet. And so I pass this through the hole into the skull, and when I'm at the right depth, I'll hold the tubing, pull the stylet back out, and then at that point the fluid will start to drain out, and I'll let a little fluid drain out. And then what I do is I tunnel the tubing under the scalp and exit it back here somewhere, and I'll suture that tubing to the scalp. And then we hook the tubing up to a monitoring system that will monitor the pressure plus allow us to drain the fluid off. And so it's a very common procedure that a neurosurgeon will perform. I've probably performed 500 to 1,000 easily over my career. It's performed in the hospital for life-saving measures.